When I first started my practice, one of the things I noticed that I didn't have a ton of options for my patients with pain. And I specialize in Lyme disease, and there's lots of joint deterioration with Lyme disease and a lot of pain. And so I just thought, I've got to learn something. So I was actually divinely led to stem cell therapy, and I didn't know much about it. I learned a little bit about it in medical school. And so I went to multiple trainings, and at first I thought, these are a little controversial and they're really expensive. So if I'm going to do stem cell therapy, I really need to know what it is. And also I need to watch it work, because if it's not going to work, I'm not going to take that money from my patients and then it not work. So I went to training and I learned how to do it on all the joints for multiple things. And one of the things that I was so excited in the first 6 months was how well they worked. So now we do tons of stem cells. I've done over 1,000 stem cell injections. I do multiple a month. I have patients that skip down my office after they've had stem cell injections. I have whole baseball teams that are seeing me now, whole professional golf teams that are seeing me now. So I really want to talk about stem cell therapy and why and how it works. So when you have an injury to a joint, whether it's your rotator cuff, and part of that is your supraspinatus, your biceps tendon, your infraspinatus, whatever part of that joint is having problems, oftentimes you'll get a little tear. And as time goes on, you're tearing and you're tearing and you're tearing. And finally one day you're like, you know what, I can't tolerate this anymore. I'm gonna go see my chiropractor. You see your chiropractor for a little while. It doesn't get better. Finally, you go do imaging, you find the tear's gotten worse, and your really only option in the United States is surgery. So my favorite thing about stem cells is we're keeping patients out of surgery. And so what happens is we do platelet-rich plasma, which is PRP. So how the procedure goes is you come in, we draw off 60 cc's of your blood, we spin off all your red blood cells, and then we spin off all your white blood cells, and now you're left with your platelets. And they're a little bit gelatinous. And basically that's rehydrating the joint, because what happens is if you have bothered your supraspinatus and you're having a hard time with this, or you're having a hard time with this, what happens is that joint, after 6 months, the immune system's, or 6 to 8 weeks even, the immune system's like, I didn't get that fixed, and I've got other things to do in the body. So now you have a joint that continues to deteriorate. The immune system and the inflammation aren't there anymore. And so now what we need to do is say, hey, we still need help over here. So when you put in the platelets, what they find is they're full of sort of this signaling that says, hey, we still need help over here. And so it brings back in the circulation, it brings back in some of the immune response that will help rehydrate that joint. And so that's what platelet-rich plasma is. It's using your blood, part of your healing process of your blood, to put it back into a system of the body that says we still need some healing here. Now, I always say that PRP is like the soil of a tissue. Stem cells are the seeds. So what that means is if you have a tear in your supraspinatus, or you've got something else going on there, and you put in the stem cells, then what they find is it actually regrows and regenerates that tissue even better. And honestly, it does sound too good to be true, but we've seen it work so many times that it's exciting to be able to talk to you on this video. So typically patients come in, we do the PRP with the stem cells, and then we wait 3 to 6 months, because what they find is that even if you're bone on bone in your knee or your hip, is that somewhere on the head of that bone, there's still cartilage, there's still some. You're not going to be totally bone on bone. There's still cells in there. And so if you can start regenerating and rehabilitating those tissues, then you're going to have more success to keep people out of surgery. The other thing that's important to know is in the United States, we use a lot of cortisone shots in a lot of different places. And the thing that's important to know, and I'm just going to share this research study with you, is they took rabbits and they took their Achilles tendon, and they did the same injections that they would do in, let's say, a knee that's having problems. And then of course it's research, so sadly they killed the rabbits. And what they found is the stretchability of that tendon was almost 70% less than in a normal tendon. So what we're finding is that actually the cortisone dehydrates the joint even more, and it dries up the joint even more. How many people watching this video were like, oh my heck, I got a cortisone shot and it was wonderful, and then I went for a couple months and I went in again and it worked for a couple weeks, and then my third one it didn't work at all. You're degenerating the joint even more with cortisone because you're dehydrating that joint even more, and now they're finding that after a while it just doesn't work and you've created more damage. So this is a really great way to use part of the immune system and part of this something that can regenerate that tissue. And so typically with my patients, we'll do the injections, we'll wait 3 months to decide if we need to do another one. Sometimes we'll go 6 months, because what they find is that those stem cells are still working within that body for even 6 months. One other thing to know about stem cells is there's been a lot of controversy in stem cells, and we use the mesenchymal stem cells that come from the cord blood lining of the placenta. and the placenta has been donated by a mama who had a cesarean born baby, and she's donated the placenta for this specifically. So the baby was born healthy, there's no fetal tissue in it. I also don't use a Morton's jelly. I don't use anything additional in my stem cells because I want to make sure that my patients don't have any immune reaction or any other problems when they're doing the stem cells. The other thing that can be confusing is when you look at the research of the stem cells that become tumors and all of that stuff, is they're using what's called a pluripotent cell. So when a cell first comes out, you use the mesenchymal cell, and it has to be able to return back to what it originally was. So for example, if you take a mesenchymal stem cell and you put it in a petri dish with cardiovascular cells, eventually that mesenchymal cell will start pumping like the other cells of the heart. You remove those cardiovascular cells, and now that stem cell goes back to being a regular mesenchymal stem cell. Pluripotent cells can't do that. They've already gone through mutation, and so once they start growing, they can't stop growing. And that's why oftentimes when you read all this scary research about stem cells, what you're probably researching is a pluripotent cell. Now, a lot of people bank on the fact that you are not a stem cell specialist, and so you're not going to know the difference between the stem cells, and so it's important to know what kind of stem cells you're getting. Thank you so much for watching our video. Please subscribe below so YouTube knows that you like this content. Ring the bell. Much more to come, and please leave a comment if you have any additional questions or comments. Thanks a lot.